Thank you very much. Good afternoon to everyone. I would like to thank the scientific board for this invitation and all of you for being here. For the use of artificial intelligence in medicine. As we know, modern medicine faces the challenge of acquiring, analyzing, and applying a great amount of data to solve complex critical problems. In this scenario, artificial intelligence technology serves to develop programs to help professionals to diagnose, predict, and results, and make therapeutic decisions. But like any technology applied to man, the use of artificial intelligence poses ethical questions. This presentation aims to outline an ethical pathway for the use of artificial intelligence in medicine based on the ethical framework of theorized by Edmund Pellegrino. Edmund Pellegrino is a Georgetown professor that has developed a medical ethics rooted in virtue, grounded on the solid foundation of the philosophy of medicine. As we know, in the 1956, the historic Dartmouth Conference, which is considered the official birth of artificial intelligence, McCartney coined the first definition of AI as follows, I quote, "The science and engineering to make intelligent machines." But what is considered an intelligent behavior for a machine has changed during the time. Indeed, actually, AI is a broad category that includes diverse abilities like vision, speech recognition, data analytics, machine learning, and just about anything that computers can do. As we know, AI entered on the third boom thanks to the deep learning algorithm, which provides remarkable autonomy to the systems. And recently, generative artificial intelligence tools like ChatGPT are gaining a lot of interest that concerns also medicines. Since its early days, AI has been used in medical data analyzing and imaging studies. In fact, assisted diagnostic systems have been in use since 1970. But the consolidation of artificial intelligence has sparked the interest of many researchers in exploring the potential applications in various fields of medicine. So that in 1980, the application of AI in medicine and healthcare has acquired a significant protagonist thanks to the creation of a group within the American Association for Artificial Intelligence exclusively devoted to the research of AI medical applications. Radiology, for example, radiology together with image analysis has been the pioneer specialist in this digital area and are the most favorite for the use of AI. Nowadays, there are numerous present applications of AI in medicine, for example, like diagnosis, image analysis, pharmaceutical development, public health, robotic medicine, telemedicine, clinical trials, surgery, and so on. The progress of AI in the medical field is consolidating a new area of medicine known as augmented reality in healthcare, where technology is developed to develop programs to assist professionals in diagnosis, outcome predictions, and therapeutic decision making. But the increasing prominence of AI in the medical field has given rise to a new model of medicine, which is known as 5P, for the medicine that is called personalized, predictive, preventive, participatory, and precision medicine. There is no doubt that AI is greatly transforming the healthcare systems. But in the realm of this medical artificial intelligence, there are two positions. We can find on the one side the substitutionist, which thinks that artificial intelligence will replace doctors will become obsolete. And the other part, we can find the extensionist, who argues that no, that artificial intelligence just will improve and will enhance the capability of the professional, but without replacing them, because artificial intelligence doesn't have emotional intelligence and empathy that are two characteristics or two conditions that are very important in the medical field. As we know, ChatGPT-4 is a true revolution in the field of medicine because it's the first general purpose intelligence that can make a significant contribution to these fields. The authors of this recent book put forward an hypothesis of this symbiotic medicine that emphasizing the collaboration between the professionals and the artificial intelligence. And they also said that doctors will be substandard if they don't use artificial intelligence. However, we can cite out 3 entrances points that they say in this book. For example, that artificial intelligence is supplementing than are replacing the medical doctors. We can trust artificial intelligence, but we also have to verify the results. And of course, artificial intelligence, it does not replace human touch. The AI revolution is also evident in the academic field. For example, the New England Journal of Medicine, AI is a monthly journal that publishes cutting-edge research and applications of artificial intelligence in medical practice. So we know that artificial intelligence is very important in the medical path. But the same happens with other technology that is applied to man. Artificial intelligence goes hand in hand with some specific ethical questions related to its use. For example, it is sufficient to follow the results of the algorithm to guarantee a good medical practice, for example. Who is responsible for an error resulting from the application of artificial intelligence? What happens when there are no guarantees of safety? What happens when the algorithms recommend a course of action contrary to the ethical values of the professional? And does following the results of the algorithm reduce professional responsibility? Undoubtedly, these questions belong to ethics, that is an epistemological different field from computer sciences. Concerning medicine and healthcare, the literature also recognizes the necessity of an ethical use of artificial intelligence, and the major challenge to account is on a trustworthy AI. In recent years, different organisms have given different orientation for an ethical and reliable artificial intelligence. For example, the Ethics and Governance of AI for Health from the World Medical Organization on 2019, the recommendations on the ethics of artificial intelligence from UNESCO in 2021, and the artificial intelligence in public healthcare from the Pan American Health Organization also in 2021. In the IDRIX report of 2019, highlights also what are the main ethical challenges associated with AI. For example, it states in the interpretability and explainability, transparency, accountability, data privacy, for example, safety, etc. Indeed, many of these problems that are identified are related, as we can see, with the design, programming, training, and functioning of the algorithms, which are issues that goes beyond the competence of a healthcare professional. We can say that these are meta-medical problems. So, considering the Aristotelian distinctions between poiesis and techne and praxis on phronesis, we can trust a roadmap for the use of artificial intelligence from the practice perspective. That is to say, from the perspective of the subjects that performs of act. In fact, the health professional is a moral agent that uses artificial intelligence as a tool to achieve an objective, which is the patient's good. So, in my way of seeing, the medical ethics developed by Edmund Pellegrino is a valuable epistemological perspective to get a path on reflection on the ethical problems derived from the use of artificial intelligence in medicine. As Shannon Ballor asserts, the answer for which questions about emerging technology bear are simply not the yes, no, or right or wrong sort. Instead, they are questions of this sort. How might interacting with social robots help, hurt, or change us? What would count as better enhanced human being? These questions invite answers that address the nature of human flourishing, character, and excellence, precisely the subject matter of virtue ethics. Since the beginning of his academic career, Pellegrino has projected a propedeutical philosophy of medicine for a new scientific humanism for an increasingly technology society. He asked, and I quote, "When everything is possible, how can we distinguish what should be done from what can be done?" End of the quote. The answer to this ethical question is preceded by a deep philosophical reflection on the identity of medicine. Indeed, Pellegrino develops a medical ethics based on virtue, on the solid foundation on the philosophy of medicine. Pellegrino inscribes the essence of medicines in the category of the relationship. In fact, medicine is a healing relationship that comprises two dimensions, the therapeutic curing and the helping the patient. And one might ask, can this therapeutic relationship be reduced to a series of functions performed by an algorithm? Medicine is thus a human activity and therefore a moral enterprise whose duties derive from the goal of the doctor-patient relationship. In this sense, Pellegrino understands medicine as an art that demands the fusion of a technical competence and a moral judgment. Consequently, a good medical decision entails an intrinsic ethical dimension that exceeds the epistemological scope of medical science. The medical act is shaped by an objective that is the multidimensional well-being of the patient, which comprises several dimensions, like the clinical good or the medical good, the good as perceived by the patient, the good of the patient as a person, and the spiritual good. Hence, the centrality that Pellegrino gives to the virtue of prudence in clinical judgment is clear. This virtue allows the discerning which means are more appropriate in certain circumstances to achieve the good of a particular patient. So the reflection of the use of AI in medicine from this perspective, it can be posed as follows. How does AI influence achieving the telos of medicine, which means help us to achieve the good of the patient in this holistic way? I believe that only from this perspective, it is possible to engage in a reflection on the specific goods that might be affected by using AI. Pellegrino develops a medical ethic articulated around three phenomena of the physician-patient relationship that are the fact of illness, the act of reflection, and the act of medicine. And from these phenomena, it is possible to outline an ethical roadmap for the reflection of the views of medical artificial intelligence from the praxis perspective. In first place, the act of illness. Pellegrino's ethical proposals is related to the phenomenology of illness. In fact, in contrast with the third-person perspective, which is characteristic of the biomedical naturalistic model, the phenomenological perspective that highlights how the disease is experienced constitutes a central element that cannot be ignored in clinical reasoning. The phenomenology of illness can be considered an important part of the practical knowledge of prudence because it allows the identification of relevant data to determine the best clinical action in a particular context. Adopting this perspective is an important talent for the use of artificial intelligence in the medical field. In fact, as Goldman asserts, and I quote, the use of AI in medicine reaches its limits when confronted with emotional, social, and non-quantifiable factors that contribute to illness. End of the quote. So ignoring the non-quantifiable variables, sources harms this physician-patient relationship. The doctor-patient relationship is thus limited to the technical expertise because relational moral competency, as we have said, is intrinsic to it, specifically compassion and empathy. So ignoring these non-quantifiable sources also affects clinical judgments. The professional is a judge who must make reasonable and ethical decisions considering many factors such as emotions, religious belief, the patient's personal preferences, etc. So the complexity of the phenomenon of illness therefore cannot be circumscribed to quantitative variables and consequently to the algorithm's logic because data is only a part of the reality. What follows is that AI can contribute to the epistemic injustice when it is considered as the only source of knowledge for the therapeutic approach. I believe that the use of AI shouldn't prevent from going far beyond the quantitative evidence that results from data. On the other hand, it must be considered that the personal circumstances of the patients determine the most convenient therapeutic option, and at the same time, the moral obligation of undergoing a certain treatment, which is to say that the phenomenology is such a complex phenomena that it cannot be reduced only from the quantitative data that is what the algorithm can give to the doctor. Okay, the act of profession. No? Pellegrino understands the doctor-patient relationship as an asymmetrical relationship between a vulnerable person and another person who can help them. The structural element of this relationship is trust, that it's built on two premises. The first one, the doctor is competent thanks to its knowledge, and the second one, that the doctor will use this knowledge to act on the patient interests, that is, respecting and protecting the patient's conception of a good life. Trust relies on these good intentions of the professionals. The lack of trust in artificial intelligence is currently the main barrier to its use in the medical field, especially when it comes to the black box algorithms. However, since the complete explainability does not seem possible in the current state of the art, I believe that rather than a complete transparency, it would suffice for the medical professional to have a solid evidence of the AI algorithm's safety and efficacy, just as the evidence that is required before, for example, using a novel therapy. That is, it would suffice for the professional to have a moral certainty about the reliability of using the algorithms in a particular clinical context. This moral certainty is what guides, in fact, the prudential judgment. On the contrary, I consider that if it is not possible to guarantee the reliability of the algorithm, or if the professional has serious reason to doubt about its safety, it would be necessary to hold the precautionary principle. It is worth noting that despite the enthusiasm of the use of AI, few examples illustrate its impact on the clinical practice. Therefore, it is necessary to balance the trust placed in technology with the real possibility it offers. This raises the issue also highlighted by the literature of the need for validation of algorithms before and in clinical practice. And last one, the act of medicine. As we know, decision-making is the central element of this prudential medical act, and since AI is closely related to the decision-making process, it is worth asking what role plays in it. Of course, delegating the decision to an algorithm already implies an ethical stance. And although most of the literature does not view such delegation favorably, it recognizes the risk of the automation complacency associated with the use of AI in decision-making. That is, the professional trusts the algorithm more than their clinical judgments. As the algorithm results is merely data, applying such a result cannot be considered, although a morally neutral action, nor it can, as some authors argue, diminish the responsibility for the decision that it's made. In my opinion, the ethical evaluation of the AI use in the medical decision-making encompasses three questions. The first one, is it a tool or a replacement for the clinical judgment? The second one, it is an advisory or a normative tool? And in the last place, what type of decisions are left to the AI algorithm? Recognizes the significant advisory value that, in fact, AI results can have for the clinical judgment regarding also the therapeutical dimension. I believe that the shared decision-making is an indispensable element for the prudential medical act. Indeed, the decisive question of a clinical judgment is whether a particular treatment should be applied to these patients or not. So what the patient thinks is also very important for this prudential act. This leads us to agree with Qin that clinical judgment requires a pluralistic epistemology capable of integrating evidence-based statistical approaches and of also virtue-based epistemological approaches. Given the complexity and the impact of the decision-making in a particular situation, such as an emergency triage, limitation of therapeutic effort, or end-of-life care, as I see, I see that it's ethical problematic to consider the AI algorithm result exclusively as a defining element of moral judgment. As Pellegrino evidence, technically correct conclusions may not necessarily be the best for these patients. Furthermore, as Schoenberg points out, the algorithm is only apparently neutral, and its design results from many decisions may contrast with the professional ethical principles. So this is a very important point to have in mind. The right to autonomy also requires that the patients be properly informed to give a valid consent. So I think that in some circumstances, the inherent risk of AI in medicine use must be disclosed to the patients. Otherwise, informed consent must be compromised. And the phenomenon known as diffuse responsibility refers to these new situations where artificial intelligence use generate an attribution of responsibility spread with diffuse boundaries between the program and the physician. The issue of responsibility for this error or harming that results from the use of artificial intelligence is complex. It involves technological and human factors. Like any tool used, I think that the professional is the ultimate responsible for any potential harm, of course, to the patients. So the conclusion is that medicine faces the challenge of acquiring and analyzing large amount of data to solve complex clinical problems. AI technologies are being leveraged to develop programs that assist professionals in diagnosis, outcome prediction, and therapeutic decision-making. The use of AI in healthcare raises specific ethical concerns. And taking into account Aristotle's distinction between poiesis techne and praxis phronesi, from the perspective of praxis, it is possible to trace a path to reflect on the ethical issues related to the use of AI in medicine. Edmund Pellegrino's medical ethics provides a valuable path for reflection that also allows for further deepening. And I finish with words of Shannon Baller that says, predicting the general shape of tomorrow's innovation is not in fact our biggest challenge. Far harder and more significant is the job of figuring out what will we do with this technology. Thank you very much for your attention. I'm able to respond some questions if there are, or I can share my email to continue in chat. Thank you very much.
Thank you, Dr. Maria.